talking about expert medical opinion. So, similar to if you were doing a court trial or what have you, an expert opinion is really provided for educational purposes, and it's used to educate the receiving audience. So as it relates to healthcare, an expert medical opinion is used to educate the client, e.g., for example, a case manager or a risk manager about the care that's been provided. So you can learn whether the care that has been provided is appropriate, or for a certain condition when the injured worker is expected to reach maximum medical improvement, etc. And that's one of the things that Best in Class provides, and we like to think of ourselves as being sort of like the in-house medical medical opinion or in-house chief medical officer for some of our clients, because we can educate on different difficult topics. And then when you think about an IME, or an independent medical evaluation, this is generally performed in the context of a legal or an administrative proceeding. And it's used to, really inform legal claims, medical claims, litigation requests. It has to involve a physician who has not been previously involved in that worker's care. And it's often performed in person and requires, a very, detailed level of clinical physical examination to corroborate some of the physical exam findings that have been previously documented by the treating physician. And then it can determine things like, was an injury sustained at work, or does further care need to be provided? And in some cases, the medical doctor who's providing the IME can be deposed, where they will basically testify to corroborate or discuss further their findings at the IME. And then an impairment rating, the third facet here. Impairment rating is usually determined as a percentage that is used to represent the degree of an individual's impairment or disability as it relates to deviating from the injured individual's normal health status and their functionality. And within the impairment rating realm, there can be such things as whole person impairment, or permanent partial impairment, depending on the jurisdiction or the request of the person who is looking to get the impairment rating. And then the medical examiner, the clinician, will typically provide the impairment rating. And impairment rating, I would say, of the three, is probably one of the lesser known facets of opinions provided by experts, and truly is one of the areas where there's significant opportunity for improvement. There can be a significant disagreement, despite there being standardized guidelines. So a lot of opportunity in this space.